remind him that the last time he sent the money, it was not enough to buy all the provisions.
Oh, sorry, I forgot to tell him.
Are you guys talking about money transfer to buy provisions?
Yes.
But don't you know about Baluwo?
Baluwo? What is Baluwo?
Baluwo is a service that your son can use to send provisions directly to you guys from the shop. And you don't have to worry about the exchange rate.
Tell me how Baluwo works.
It's very simple.
Just log on to baluwo.com and shop, or download the app on your phone. You can shop on the website or using the app to buy online basic products for your family and friends. With Baluwo, you decide what your money is spent on. Your money, your choice. Buy online products for your family and friends in the Gambia, Senegal, Nigeria or Mali. Baluwo, better than sending money.
In communication, connectivity is everything. We ensure that the links never sleep. Quantities and qualities, all in our data service, providing efficient, reliable voice and data service. We believe if you're not up to speed, then you're going backwards. Communications have to flow as fast as the speed of light. Whatever business you're in, having someone who understands your needs is critical. That is why we just don't offer you technology, we offer you solutions. Enjoy Gamcel's internet broadband anytime, anywhere. Your national operator, Gamcel, Yaibaram.
Good morning, Honorable Minister of Health, Honorable Ahmed Lamin Samate, His Excellency the Ambassador Ma Jian-chung, Ambassador of China to the Republic of the Gambia. Today we are witnessing the handing over of these items donated by the Chinese Embassy under the coordination of His Excellency the Ambassador to the Minister of Health to be handed over to Honorable Dr. Ahmed Lamin Samate on behalf of the Minister of Health and the Government of the Gambia. So welcome to this important handing over ceremony, and I now invite His Excellency the Ambassador to go and give a statement, and from there he will hand over one of the boxes to the Minister, who will also give a statement. His Excellency, welcome.
Mr. Samad, PIS Lamin Jetty, and the Director of CMS, Mr. Sabali. Good morning, ladies and gentlemen. I'm delighted to attend today's handing over ceremony of medical supplies donated by the Chinese Embassy to the Gambia Health Ministry. Since COVID-19 broke out at the global level, we have been constantly updated about the pandemic situation with Gambia, and have donated various kind of medical supplies to the Gambia government several times in the hope to assist our Gambia friends to win the battle against the coronavirus. Today's medical supplies include 15,000 face masks, 18,000 pair of hand gloves, 500 pair of shoe covers, 250 protective clothing, 250 safety goggles, and 24 head thermometers. Since the first COVID-19 cases in the Gambia was reported 2 months ago, the Gambia government, particularly the Ministry of Health, took a period of measures to contain the spread of disease. These measures have been proven fairly effective. To achieve that, Honorable Minister Samad worked tirelessly. On the one hand, he has been busy traveling and giving instructions from border spots to hospitals, to quarantine facilities and other crucial sites as to ensure effective and efficient functioning of the Gambia's disease control system. On the other hand, Honorable Samad worked hard on COVID-19 publicity, organizing press briefings to release reliable information timely, calling on people to protect themselves. I would like to express my heartfelt appreciation and admirations to Honorable Minister Samad and his colleagues. And I firmly believe that with such good efforts and cooperative support from international partners, the Gambia will no doubt win the battle against the COVID-19. Ladies and gentlemen, while the pandemic is wreaking havoc on the world, Chinese President His Excellency Xi Jinping has been promoting international cooperation in this common war against the disaster, coronavirus. Towards the vision of building a community of shared future for mankind, Chinese government has been engaged in such international cooperation with openness, transparency, and reliability. Also, recent news shows the virus might have been spreading in a few countries on different continents as early as November to December last year. China was the first to report infection of the novel coronavirus, and China was the first country to carry out study and share genetic sequencing information of the virus with the international community. We have been actively updating international partners with latest information about COVID-19 outbreak in China, carrying out international cooperation on medicine and the vaccine development. All of those to make our contributions to the security and health of the people across the whole world. Recently, in April, in the G20 finance ministers video conference, China actively supported the initiative to suspend debt service payments for the world's least developed countries through the end of this year, which was quite helpful to lighten debt stress and reduce financial risk for countries, including the Gambia. Facing the pandemic, we should adhere to the principle of fighting the disease with science and technology. We should respect research and suggestions from trustworthy scientists. We should note that any attempts to politicize the pandemic are unhelpful and harmful for promoting the international, international cooperation. And we are against the interest of the World Health Organization. I would like to emphasize that the World Health Organization is the most professional and reliable international organizations in the world in the field of public health, and has been playing a key role in the global battle against the COVID-19. China firmly supports WHO leading role in global response to epidemic. The Chinese government welcomes WHO's global collaboration initiatives to accelerate the development and production of vaccines and drugs against COVID-19 and ensure their equitable distribution. and China have decided to be part of it. Ladies and gentlemen, under the leadership of His Excellency President Adam Barrow and the efforts of the whole Gambian people, the Gambians' performance in fighting COVID-19 has been fairly commendable. China would continue to provide support to the Gambia, sharing our experience and joining hands with the Gambia to work towards building a community of a
Thank you. Well done. Well done. Excellency, the Ambassador. And now we will just invite you to give the box to the Honorable Minister. So now, the Honorable Minister of Health, Honorable Lamin Samate, will now make a statement. Thank you.
Thank you very much, Mr. Chair. Your Excellency, the Ambassador of the People's Republic of China, Ambassador Ma Jianxun, the Permanent Secretary, Ministry of Health, the Director for National Pharmaceutical Services and his entire team, the Director for Health Promotion and the entire team, my distinguished colleagues here, distinguished men and women from the media, ladies and gentlemen, we are gathered again here to receive these donations from the Embassy of the People's Republic of China to the Gambia. We must say we are delighted once again. This is a show of the demonstration, it's a demonstration of the good relationship between the two countries, but also more so between the embassy and the Ministry of Health. The embassy, under the leadership of Ambassador Ma, has been very proactive, has been engaging at high levels since the outbreak started in Wuhan province in China. We have received regular updates. Then we thought COVID could get here, but we were not sure really if it would, and even if it does, when it would. However, even then, we had learned a whole lot from the Chinese response through the good work of the ambassador. We thank you very much, Ambassador. We've all seen the challenges caused by COVID-19 throughout the world, the devastation, the loss of life, the distortion of human activity, the impact on the economies, the impact on families, the impact on communities. This has been unprecedented. We've never seen this before. So COVID-19 is a big challenge for the entire world, not just the Gambia. We are very happy to be here again to get the support needed to tackle COVID-19. The ambassador and the Ministry of Health and the government of the Gambia is very particular about the welfare of our frontline health workers. The protection of the people who go out, sacrifice, participate, spend very long hours to care for the affected people, to care for the infected people, and to help in protecting the other people with the help of the Almighty Allah. Their protection is very important to us. That is why anytime we get requests for assistance from partners, high on the agenda is the issue of personal protective equipment. Now, we are happy that most of these are personal protective equipment and the diagnostic tool of the infrared thermometer. Ambassador, this will go a long way because we need to keep our people safe so that they can continue doing what they know best, that is caring for the people of this country. We thank you once again. COVID-19 is a global challenge, but irrespective of our challenge as a nation, we are happy to say that Gambia has been doing very well by virtue of what we've been able to do, and even more so when we compare with other countries in the sub-region and in the world. When we got heed of the existence of the outbreak in Wuhan, we started strategizing very early, earlier than most of the other countries, especially in the sub-region. We issued out a press release to inform the general public of the existence of a new disease, which was then called novel coronavirus disease. The disease had not even gotten a formal name, but even at that point, the people of the Gambia were informed as to the existence of this disease and to start preparing, as we were thinking that it could get here, and we were right that it has gotten here. This communication has been ongoing from the onset, and it is still ongoing, and it is even being intensified. Public speeches have been given from the highest office, from the president himself, demonstrating the commitment of the government of the Gambia in tackling COVID-19. Public speeches were made, interviews were given, regular press briefings were given, radio talk shows were held, radio interviews were given, mobile information services have been ongoing, posters have been produced, billboards have been produced, all in the view of making people more and more aware. Of course, the awareness level is increased. It is increased drastically. However, there's no room for complacency. Certain aspects of our lives have changed. We realize that people do not shake hands anymore, which is one of the points that have been advocated. That means people have heeded to the advice. However, there are still a lot of things pending. One of them is the social distancing. We have said that communicable diseases, the infectious agents don't move by themselves. It's usually human activity that moves them. Sneezing, coughing, sometimes spitting, and interactions, close interactions. So it is certainly common sense to know that when we keep social distances, the rate of spread will be reduced. We have also been advocating the use of the mask, something that comes from the nostrils, from the mouth, from one person to the other. If those orifices are covered, the risk of spread will also be reduced. And this has been evidenced by the low rate of cases in countries that had started the use of masks long enough, early enough. And we've also seen countries that have been badly affected, everybody is now putting on the mask. We had the opportunity, and we should not miss that opportunity, to learn from the experience of other countries. We have seen where COVID-19 had been devastating. We had seen the challenges they had. We had seen their response. We had also seen the outcome of those responses. We had also seen countries where they were led to react, and we have also seen the consequences of those reactions. So to say, the Gambia and many other countries in similar situations have had ample time to learn from the others as to what to do. And we appeal to the Gambian public, we should not miss this opportunity to act decisively in trying to contain COVID-19. We have realized that the number of cases in this country have been increasing over the period because now there is local transmission. Yes, the majority of the people came from neighboring Senegal. The borders have been closed, but we've been having a whole lot of challenges trying to maintain that. One reason is the Gambia is a small country with very porous borders. Now, because the Gambia is a small country, the destinations of most of the people coming to the Gambia is very close to the border. So people come from all over, surrounding us, and they enter and sneak into their destination easily. For a big country, it would have been more difficult because the destinations would have been further away from the point of entry, that is the border point. So this disadvantage makes it even more difficult because anywhere around the border points that people sneak into the country, they get into a community immediately, and then it is difficult to trace them. At this point, we appeal to the communities. Yes, some communities benefit from people coming in and out, but certainly when there are disastrous situations of the spread of this disease, the communities and the whole nation will suffer. So we therefore appeal to the communities. The security forces are doing very well. They are trying, but we also encourage them to try even harder to make sure that people do not sneak into the country. At this juncture, we'll also want to appeal to the public to stop stigmatizing the people who are infected or the people who are affected. We should be mindful. These people are also human beings, only that they happen to be infected and they got sick. But that doesn't make them less human. They deserve compassion from all of us. And so a few weeks ago, if anyone had told these people that they were going to be infected or they are infected, they wouldn't believe them. And today they are affected or infected. I don't think any of us knows who the next person is going to be who will have their kind of experience. So and that is not good. It is not good for the patients themselves. It is not good for their families, and it is certainly not good for all of us in this country. So let us be supportive to them. Let us do away with stigmatization. They are human beings. They are part of us. They are family members, and they need the support that they should get. So let us all support them and and show them gross consideration. The Ministry of Health is doing what we can do to provide the adequate services. We are strengthening the health facilities. We are providing equipment. We are providing consumables. We are renovating treatment centers. The construction of more treatment centers will start very soon. The process has been ongoing with due diligence to the procurement rules. The assessments were done, bills of quantities were developed, and the procurement process is being followed. Tender documents are being produced, are being prepared, and very soon they will be advertised quickly so that the process is fair for all potential competent people to apply and construct these facilities in a very short period of time. Certainly, we are in an emergency situation, but we also believe in due diligence, because due diligence is the right thing to do. And we also want to assure the public that at the Ministry of Health, there is due diligence in whatever we do. Yes, sometimes people could be talking. Yes, things are delayed, this and that and that. But believe me, if due diligence is not followed, the same people will be the ones up again screaming at the top of their voice that due diligence was not followed. So at the ministry, we are going to follow due diligence to make sure that we do whatever we do according to the rules. We are guided by the rules. But nonetheless, at the end of the day, we hope to achieve the best for this country. It's also important for us to note that recently we got organic products that were donated from the government of Madagascar to the government of the Gambia for the prevention and treatment of COVID-19. These products are in country. They've been handed over to us, and they will soon get to the logistics people. The product is being reviewed. It came with literature to emphasize its efficacy. It's being studied, and the technical people, the experts, are going to sit down and strategize. It's not been used yet, but we are going to strategize to look at it and to see what we can do with it. We are trying to also engage with our counterparts in Senegal to see what collaborative efforts can be put forward with regards to this use of this product and other modalities of control, strengthening the borders, and other areas where we can collaborate for the good of our people, because most of the cases we get in really come from Senegal. So it's important for the general public to know the product is here, it's not being used yet, but the experts are going to sit down and deliberate to see the way forward. Distinguished guests, Your Excellency, Ambassador Ma, I cannot overemphasize the efforts, your own efforts and the efforts of your embassy that has been very, very active and very active partner of the Ministry of Health. We have stood here several times within the past few months to receive a lot of support from the Republic of China, ranging from the vehicles, ranging from donations of equipment, medications, personal protective equipment, from the government of the People's Republic of China, from the Embassy of the People's Republic of China in the Gambia, and equally from the Jack Ma Foundation. All these are good gestures from the people of China to the Gambia, and we will never forget this. Of course, a friend in need is a friend indeed. We sometimes know our true friends when there are challenges. That's when we know we have true friends. When we have the need, is when we know our true friends. When things are difficult, it's the true friends that stand by you. And we have seen the true friendship in our relationship. Thank you very much. Extend our sincere appreciation to yourself, of course, to your entire team, and to your whole government. Say to them, the government and the people of the Republic of the Gambia appreciate your gesture. Once again, thank you very much.
Thank you, Honorable Minister, for that wonderful statement, which really cleared most of the doubts of the media, especially with regards to the herbal treatment. And I think now it's all clear to all of you. Now that the process has been followed, was going to be followed before it is going to be used in country, and it's also has already cleared that information to you. Honorable, first of all, before we wrap up, I think you mentioned that a lot of sensitizations have been done, but I think we can say that the process started from you. Why I said that? Because when the preparation started in late December, you led the process, you formed the technical team around you, you went into the field, went into Amdalai, You went to the airport. That was the first point of call. And then at that place, you were able to see the flights that were coming in. At least 3 flights were witnessed by yourself. And then you were able to demonstrate hand washing at the airport. And that hand washing, which was demonstrated at the airport, attracted the views of about 79,690 people were reached on that Facebook platform of the Minister of Health for a period of 5 days after the exercise was done at the airport. So meaning that the people were so interested in what was done at the airport. So thank you for that and for taking that initiative. We've also gone to Amdalai. That has also called for about 40,000 views have also been done on our Facebook page because people have seen the interest and also the actions that have been taken at Amdalai. So that is where everything started. So we can say you started the process, the technical team followed you, and today that is what we are enjoying. Because we didn't start earlier, we would have been at a state of confusion, we would not even been knowing what to do. But because we also facilitated the development of the plan, and following that plan is really helping us to be able to implement what we are supposed to do. So we also say thank you for that. You're also now working on, in fact, currently you've assigned me to be able to identify communities along the border in Gambia and Senegal. That has also been completed because your plan is to strengthen cross-border collaboration, drawing from the experience of the malaria campaign, which was done in the Gambia and Senegal. So we also thank you for coming up with the also initiative of strengthening cross-border collaboration. So the list goes on and on. But I think we are also documenting what has been done. So anyone who wants to get information, you can always contact me for more information on what has been done from December to now with regards to COVID-19 preparedness and response in this country. On that note, I thank all of you for coming, and I now finally close this session. We go into another session.
Are you thinking of owning your dream homes? EJ Investment is here for you. Secure our quality bungalows with 2, 3, or 4 bedrooms, or our story buildings, 3 or 4 to 5 bedrooms at very affordable prices with flexible payment plans at our Sanyang Seaview Estate, where you can enjoy the cool breeze with modern infrastructure such as tar roads, covered drainage system, modern electrification with street lights, gated entrance with security posts, and social amenities such as gas station, shopping mall, medical clinic, park, schools, children daycare, and a lot more. Our dedicated team of professionals will keep the estate clean at all times, provide security and patrol team within the estate premises, install latest technologies such as CCTV, Wi-Fi, home network installation, solar panel, and power backup system. Also, check out for our additional home facilities and interior design service such as premium tiling, wall plaster, home landscape, fingerprint home lock, and a lot more. Visit our office at Senegambia Kololi Highway and get a free site visit tour, or contact us on 4464838. WhatsApp us on 3259220. Or you can visit our Facebook page or Instagram on EJ Investments. EJ Investments, we are first in properties.
Agada.
Mbijan aganyadi.
Albaka.
Mbaka important.
Yo, nga transfer la sto.
Ya transfer la sto.
Ha, code nyingi.
Okay. Korsa. Nsila ID soto.
Ah, sa soto. Sorry. Agada.
Mbijan bro.
Albaka.
Mbaka.
Bara alla service o tariya.
Ah,
mbare ki janna nun kunu bara tariya.
Ah, jannom yona forest de bureau. Gambia tonkon na no mbari ya bere. Ha. Birim koyna fo kato.
Bari si kodo kino kato ni fo bolong blabe to.
56 branches mola soto Gambia jam.
Ha?
Ha. Gambia kono ani Gambia bantala bankol. Nko kodo ki ya bere to. kodo sifa fo falindiro fo nyaadi lafta memmen na kodi topoto nin kodi maraw jannom number 1 di nyonta andum fana nata anoda enterprise sotale wala nyindi ko domorol fana kol fana be firale le dadi ma nin domorol ni fana beteat gambia dawda yalo ngam fa kendol sotale je
wo moyo diat
apelenta
ni wo ka ni na lafta nyelen kendol e binaji
yalo bu kanina ko la baraka ba
yalo ndel ciosano lo
abaraka